Thanks so much for the introduction, and I'm very happy to be here joining Ebony-Joy and our participant, and hopefully others will come as well. Otherwise, we'll have a recording, right?
Right.
Really, I think the goal of this chat today is really to kind of get a one-on-one perspective from myself as a GYN oncologist, and of course from Ebony-Joy as um, a patient or a survivor with experience navigating this cancer diagnosis and the journey. And so I think we'll touch on kind of what to expect when you receive a diagnosis of cancer. We'll talk about really how you and your doctor become partners in this journey. We'll discuss kind of gold standard of care, what to expect, what you should expect, what you should want out of the experience. Going to generally overview of kind of treatment planning, how genetic testing plays into that. And then, of course, survivorship care and kind of life beyond the cancer diagnosis. So that's kind of the general points I'll touch on. So what to expect when you receive a diagnosis of cancer? So as Marlene mentioned, I'm a GYN oncologist, so most of what I say might kind of fall to the gynecologic cancer topics, but in general terms, this visit with an oncologist is it's just a lot of information. It's full of information that you need to be able to digest and process in the moment, or then go home and process. You could be walking into this meeting already knowing you have a cancer diagnosis, right? Or you're walking into this meeting because somebody was very highly suspicious that you may have a cancer diagnosis, and now you're meeting this oncologist for the first time, who is then going to tell you, yes, here is the result that confirms the diagnosis. So it can be very challenging either which way you're going into it. And so I always encourage patients or people to come with somebody. I think having a friend or a family member um, with you always helps. Another set of ears, another set of eyes. If you know somebody who has medical knowledge, that might be helpful too, right? Maybe they are in the field, or maybe they've been through the same diagnosis or another cancer diagnosis. And so having that person at your side might be helpful. Or maybe you just want to come alone because it's easier for you to process things alone without somebody else kind of chiming in. Um, a lot of patients who come see me, they take notes. They like to write things down, or sometimes I may ask to record the session. I think if you want it recorded, you have to ask the provider, and it's provider dependent if they're going to allow you to do that or not. It's based on policies. It's nothing personal. But taking notes is, I think will help you remember what was discussed and kind of the highlights of the discussion. You're going to expect a general overview, right? They're going to tell you about the cancer diagnosis. They're going to tell you about what it means, if they have the information on how low risk or high risk the cancer is. All these things should be explained to you. You will either have already had some kind of scans or imaging or testing to assess how far advanced this cancer is or how localized it is. And so all that information will be shared with you as well. The conversation will then should expand onto what kind of treatment approaches there are. And then something that I explain to my patients is that having a cancer diagnosis is really, it's devastating. You kind of are frozen. You don't know what to think, what to say. I think a lot of people think about their life and kind of, is now my life kind of shortened because of this cancer? And so I try to emphasize that with this cancer diagnosis, very important positive aspect to look at is that there are treatment options. Having treatment options lends itself to the likelihood that this is going to be a good outcome or a good prognosis. And so understanding those treatment options asking those questions with this doctor that you've met will help you hopefully feel more reassured that, okay, I have this cancer diagnosis, but at least I have options to get rid of it, to fight it, to improve my chances of survival. And in my world, for the gynecologic cancers, a lot of them involve surgical intervention. So that's something that I speak to a lot with my patients. We talk a lot about if the state of the cancer that we found it in is amenable to surgery. And then I go into a lot more detail on surgical intervention. And then also some of those cancers then may need chemotherapy, radiation after surgery. So then we go again into those details. So it's a lot of information. You're going to be kind of bombarded. And so taking notes helps. Asking for patient information packets is also very helpful. If the doctor's office has that information or they have links to patient-friendly information, that will help you then further digest the information. There are many out there. Google is quite amazing. And you could Google yourself into many rabbit holes of fear or hope, whatever path you take, you're going to find the answer that you want or don't want. And so I never tell patients don't Google or don't do anything. You're going to do whatever you want. But what I do encourage is maybe try to find the reputable sources. American Cancer Society is great. Foundation for Women's Cancer is a great resource. These are clinician curated materials. So then it decreases your chance of maybe getting misinformation or misguided information. I think there's also, if on Instagram and Facebook these days, there are lots of doctors on there or medical providers that offer a lot of evidence-based, clinically relevant information that helps guide the process and the navigating the diagnosis. Finally, on this topic, I think it's very important to stress is you'll be given so much information. You'll meet a doctor who is going to spend a lot of time with you. And then you may, at the end of it, feel kind of like loyal or committed to this person. Like, okay, they told me everything. They told me what to do. I really should just follow everything they say. And, it's gospel and let's just start. But remember, you do have an opportunity to seek another opinion if you want, right? I think it's so important for patients to understand that that is okay. I see many patients who are coming to me as their second opinion or third opinion. I may be there first, and then they go someplace else and then come back. And that's fine. I think it's important sometimes when you're in such disbelief or how could this happen to me kind of phase of the journey, you may need to hear it again from somebody else, from another expert. And that's okay. Nobody gets offended. Maybe some do, but I don't. It's important to know that it's your journey. It's your decision making. Our job as the doctors and surgeons is to give you the information and guide you on this journey and help ensure that you have the best outcome. And you have to feel comfortable with that person sitting across the table from you. You have to feel that they have your best interest in mind, that they're compassionate, they're empathetic, that they're understanding, and that the team around them also is the same and they have those same beliefs. And so if you feel that with the first provider you've met and you've done your research and it coincides with the information they've provided, then it's a match and it's great and you can start your treatment journey with them. But if you have reservations or hesitation or it's unclear or they didn't seem to explain something as well or you left with more questions than answers, get another opinion, and then now you have two sets of information, and then you can decide which provider you want to embark on this journey with, because it's a long journey, and you want to feel comfortable and feel like you're in the right hands. That kind of transitions to your doctor being your partner, right? I mean, you're forming this bond, this partnership. And Ebony-Joy, you can chime in here. I think when we met, and had our chats prior to this meeting, that was a very, very big part of this journey for you, right? Feeling that partnership and feeling like you had a connection and could move on in your journey with this doctor.
Yeah, what you were saying about diagnosis, right? There was so much information at the beginning. So imagine going one day where I'm just going in for a scan. Like I had no suspicion of that I was going to have a breast cancer diagnosis. So I'm just in the part of, okay, let me do the scan, let me do this next scan, okay, let me do this biopsy. So my life was just like everybody up to that point was like, oh, this has happened to me. It's just protocol. Well, that Monday morning, I was on the phone with the radiologist calling me, you have breast cancer.
Mhm.
And it changed my life because I had no plan. And I think when what you hit on with diagnosis and what to expect from doctors, my breast surgeon said at breast, she said, she said, you are the captain of this ship. And what you explained about going through the steps of information, going with someone, um, all of that happened. Mine changed a little bit because then the pandemic happened, so no one could go with you. Um, so it was like support, 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 and then no one could go, and that was very traumatic. But I think one of the biggest things that you said was partnership. And I have been very fortunate, right? So I'm a Black woman, I'm 38 years old, I'm a single parent. So I'm already having challenges with just life in general. And then I'm thrust into the breast cancer world. And I'm a research person, and I'm like, okay, every Black woman is dying. Um, this doesn't look good for me.
Mhm.
In addition to when I'm sitting in waiting rooms, I remember when I first talked to Marlene, I said, I didn't see anyone getting chemo that looks like me, that's getting radiation like me, and surgery. I'm like, oh my gosh, I'm not going to be here. That was a recurring thing that I went through for 4 years. And now it's gotten from every day to every maybe month. So it's there. It's a recurring theme in my head that I'm working on. But I think the
Right.
biggest thing, diagnosis, it doesn't go away.
Mhm.
And I think what has alleviated a lot of the stressors for me is partnering with my doctor. So I recently just got a second opinion from an oncologist, and they sat and talked to me. Probably, I'm going to say 99% sure that my oncologist and everyone told me that stuff when I was diagnosed, but I don't remember it because
Mhm.
I was by myself. It was in the I was in survivor mode.
Mhm.
And so getting a second opinion, I got a second opinion 4 years later. And it was just refreshing to hear a doctor say, I would have done the same treatment plan. This is the same thing. And so, and just, oh my gosh, I wasn't present when
Yeah,
they talked about my tumor markers and all this stuff. So I was not present. So if you're farther along in your journey, don't feel like diagnosis, that's the end of the line for you. And so thank you, Dr. David West, because it, it, I am with doctors that were like, you want a second opinion? I do not feel any way about it because
Mhm.
this is your life. And so
Yeah,
thank you for saying that that's a part of the gold standard that we're looking for is go ask other people.
yeah,
And sometimes it's just maybe they're going to tell you the same thing that the other doctor said, but now you're more present and it makes
exactly.
a difference.
Exactly. And that's definitely been the experience that I've had too with a patient that maybe meets me first and then goes to see somebody else and then comes back. It's more just now they feel they, not that they didn't hear what I said, but they were kind of processing and then needed just to hear it again. And then it really solidified it. And then they felt, the level of comfort or the trust or the partnership with me versus another doctor or, whichever way. So as you had mentioned, gold standard of care and kind of what to expect. And so really all of us oncologists follow a standard of care. There's these National Comprehensive Cancer Network guidelines called NCCN guidelines that are available to the public. There's online, you can sign up to become a member for free, and you can get copies of the guidelines for all cancers, and it outlines how these cancers are diagnosed and how they're treated, if they recur, what the algorithms are for treatment, etc. So we follow that as oncologists, and that should be kind of what is expected. Um, Also, these guidelines, they guide the treatment, right? There are variations of treatment that you may or may not have depending on the cancer. So every cancer is a little bit different. A breast cancer to a ovarian cancer to a uterine cancer, um, very different in the treatment approaches, but some basic standards are there and guidelines. And then as an oncologist, based on the person sitting in front of us, based on genetic testing, um, based on other criteria, family history, or personal history, we then may modify the guidelines or may modify the treatment to fit the person in front of us. And so that's where medicine isn't just black and white. There can be gray areas. There can be areas for change or modification, all within the standard of care, right? All within the treatment algorithms. And so going for a second opinion, you may hear a variation of the treatment regimen, but overall, overarching should be the same based on these national guidelines that we have. So it's just important to know that there is a standard, there are guidelines that we're following, and we keep in mind who's sitting in front of us and what risk factors they have, what barriers they may have that could influence the treatment or adherence to treatment. And so we help navigate getting you through the treatment so you have the best outcome. I had touched on in that a little bit about genetic testing, so I wanted to kind of focus on that a little bit more. Today, genetic testing is really a pillar of navigating cancer treatment. So much advancement has come out on expanded panels for genetic testing, especially in breast cancer, and we're seeing a lot of advancement in gynecologic cancers, particularly ovarian cancers, and uterine cancers are starting to really have a spotlight on them, given the major disparities that we are seeing with uterine cancer affecting our Black or African American women. And so there is a big push on genetic testing and to see if there is any hereditary risk associated with the cancer. So it's a bloodborne risk, right? It's something that's passed on from family member to family member, or is there something at the level of the cancer? So we are now testing the cancers to see if there's any mutation or marker on that cancer that could help us better treat it. Again, another part of standard of care. So if you're going to an oncologist with a breast cancer diagnosis or an ovarian or uterus cancer diagnosis, and they haven't mentioned anything about genetic testing, you should feel empowered to ask. You should wonder and question, am I a candidate, or should I be a candidate? Should I get this testing? How will it help my treatment? So definitely you want to feel empowered to ask those questions, to request that testing, to confirm that you are a candidate for testing or not. And then knowing family history, knowing your family risks, right? If you have a lot of people in your family with cancer, that is one reason to get genetic testing. And even before the cancer diagnosis, if you're fortunate enough to know that family history, go to your general provider, ask questions about getting genetic testing, getting genetic counseling, so that maybe you could prevent a cancer from developing. But it's a major a hallmark in treatment right now. And we're really encouraging utilization of genetic testing.
Dr. David West, I wanted to just give my personal experience on that because
Yeah,
I always get a little emotional. But
of course.
so prior to my cancer diagnosis, my dad is Nigerian and my mom is African American. So with my dad's side, there was no unknown medical history. So I did genetic testing. And so I do have a genetic predisposition to cancer. I have the ATM mutation.
Mhm.
And I only had heard about BRCA, but I got tested, I think, for like 54 different
Yep. Yeah, the extended
things. So there's
panel.
so
Good.
many. And so I learned a lot about that. So I teared up when you said it because I did get I've heard that women don't get offered that. I was offered that. And especially when it comes to women that are in marginalized communities. But then what every time I talk about my kids in this, and now they were 5 and 6, and now they're 10 and 12.
Yeah.
And my history will allow them to have access to preventative treatment.
Yeah.
So they won't get genetic, they said, don't test them now. There's a 50-50 chance that they inherited the gene from me.
Mm-hmm.
But outside of that, because of the history with my genetic component,
Mm-hmm.
they will start having preventative treatment in their 20s.
Yeah.
And
Exactly.
so to me, it's scary, right? Because, I thought about it as a mother, would I have decided not to have children? But I can't deal with what ifs.
Right.
But that genetic history now helps guide their longevity. And
Absolutely.
so it's empowering. It's a hard thing to say, but I'm like, because I'm like, gosh, man, why cancer? Like I stay
Right.
in the bubble of why cancer, but you made me realize how empowering that is because a lot of women don't have that piece of the puzzle.
Yep.
Uh, and also just treatment too. That
Mhm.
helped guide my treatment plan, knowing the genetic component, because now I'm also at risk for pancreatic cancer. And
Mhm.
so I got further testing and things. So when I started having things, so it's like it's guiding my treatment, knowing this because the research, how doctors can provide, you care, is a lot of times with the genetics. So thank you for sharing that because I think I didn't know that I needed
Yeah.
that. I was
Yeah.
offered it without knowing it. I'm so glad. And it's not just helping me, it's helping future generations of my family.
Absolutely. And that's really what it is, right? You know the genetic risk is there, or the strong family history risk is there. You start paying attention more. You start noticing things more. You do your breast exams earlier. You maybe if it's something with an ovarian cancer or uterus cancer risk, you pay more attention to your menstrual cycles. You pay more attention to your symptoms. And so these are ways that we can help identify these cancers maybe at earlier stages or completely prevent them altogether, right? And maybe we can do prophylactic surgeries, right? So in the GYN cancer world, right now, if a patient harbors a high risk mutation for ovarian cancer and they're young, under 50s, in the premenopausal age range, we're offering risk reducing surgery to take fallopian tubes out. We also take ovaries out in premenopausal and menopausal patients, depending on how high risk they are. And then in the breast cancer world, there's mastectomies, right? Prophylactic mastectomy. So yes, these surgeries can be life altering, body altering, image altering, health ramifications, but these are things to discuss with your doctor, discuss, navigating those risks and benefits, and also navigating what screening tools are available, right? Knowing that you have a high risk um, genetic mutation. So very, very important to ask about that and feel empowered, and you are empowered.
And
And
I want to share that. So I have a son also, and just learning about you know, men are at risk for breast cancer,
sure.
and then the relationship with like the sexual health, well, the organs, also there's prostate cancer. So just learning all
Mhm.
of that and having open conversations within the family. And then my kids have had these conversations young, so they're aware
Mhm.
about, their bodies more and just having conversations that were not there with the
Yeah,
previous generation, or just because of culture, right? Certain
right.
cultures, it's taboo to talk about
Mhm.
health or talk about, especially when we're talking about now body parts. It's
Exactly.
taboo,
Yep.
and just you don't want to talk about bad health because then maybe it's not there. And so
Mhm.
I'm yelling it from the
Yeah,
mountaintop.
you yell it, preach it to the choir, right?
Mhm.
I didn't share with you, we have a shared background. I'm half Nigerian also, and my other half is Slovakian. And so, but yes, my Nigerian cultural component, even the Eastern European Slovakian component, definitely there are a lot of taboos around cancer and misbeliefs and misunderstandings. And there is cancer in my family and high risk enough that I went through genetic testing too. I kept seeing one patient after the other who had the exact same history as me. And I was like, well, I need to go get I need to go get genetic testing with my family history sounds exactly like this woman who has this mutation. So it's important to have the conversations and open up. And I think our younger generations are becoming more aware and educated. And I think that's lends itself to, the healthcare, and also to patient advocates like you, Ebony-Joy, who are speaking up. And because I think sometimes you have to go down to the grassroots movements and start really just door to door, speak at the community level to really get these messages out there.
Mhm.
Um,
So
so,
I have a question.
yeah, of course. I don't know who said that, but
Who's on mute?
somebody's muted, but you can unmute.
Yes. Oh, I thought I had unmuted myself.
Oh, there
Okay.
you are. Yes.
Yeah. So we can have genetic testing done anytime, even after our cancer diagnosis.
Absolutely. Yes.
Oh, okay. And then if we have daughters who are getting up to 19, 18, 20, we should have genetic testing done for them.
So that is really person dependent. I think most of us don't advocate for testing that young because these cancers are not typically diagnosed that early of an age. So it's really more 20s, 30s that you would start maybe considering genetic testing. Some younger people, they may not want to be tested that early. They maybe want to wait and just kind of utilize the family history risk to then maybe heighten certain screening. So if you are a person who had breast cancer very young and you have young daughters, then they would start getting breast screening as early as in their 20s. And maybe they don't necessarily have to do the genetic testing just as yet if they don't want to, versus they can, and they can have all the information available.
Okay. So for somebody like me, I'm a few years in, so I see the oncologist every 6 months, and it's more routine. He gives you your tamoxifen, he checks your body, he checks everything, and you're out the door. So how can I now start telling him about genetic testing and some of these things that you've spoken about today?
Right with you. The first thing when you walk into that door and how are you doing today? She's like, I'm doing great. So can we talk about genetic testing?
Okay.
First things out of
Yeah.
your mouth.
And
That's it.
yeah,
And it'll
because
pause him or her, and they'll get talking to it, and they'll explain to you why it had, for whatever reason, if it wasn't done, or maybe it was done and you don't know it was done, right? And
no,
so
it wasn't done
it
because when
wasn't.
I got diagnosed, I asked about the BRCA testing and they said you are already diagnosed, so you don't need to go do it.
Oh,
So
no,
I
no,
didn't
no.
do. Yeah.
Please, yes, definitely ask the next time you see them, or even just call the office and say that you're interested in genetic testing, that you heard a great small panel discussion that said that with your cancer diagnosis, you qualify for genetic testing.
I wanted to chime in with my personal experience. So genetic testing is very expensive. And sometimes insurance will cover it, sometimes insurance will not, but a lot of the genetic places you can call them and they will have coverage. So don't let the price be a barrier. And I actually got, because of my cancer diagnosis, my family got offered a clinical trial to get genetic testing for free or for $50 for the
Nice.
whole panel. So look out for clinical trials, talk to your doctor about it. I know I'm good with telling my doctor like 100 things at an appointment because I just unpack. And I've learned that texting through my chart gives me a better, like, I know, or I just forget to ask the doctor when I get there what I really want to talk about. So I don't know if you have an internal thing, but I message my doctor. And so a lot of times it'll be the PA that gets it, but at least there'll be a paper trail to make sure my question is answered there. But don't let the financial barrier, at least for me, I was worried and about like, how am I going to afford this? But there's funding out there for it, or at least clinical trials. And my kids, so I was diagnosed at 38, which is with bilateral breast cancer, which is considered very high risk. So my story for my children is in their 20s because they start at least a decade before. So it would be in the 20s for them. And the reason why we wouldn't test now, from what the doctor explained to me, she's like, because they wouldn't do anything. They're not going to remove anything or give treatment to a 10-year-old kid.
Yeah.
And so it will be later on, but they will, we've been, I haven't shared, they don't know now, but we'll talk about it, and they'll have to do a lot more screenings because that's with the genetic component.
Right. Now, and that's great. Thanks for bringing up the financial aspect that could become a barrier. It's important to recognize that. But I think, yeah, as you said, there's lots of ways to navigate that for sure. But yeah, again, feel empowered, ask questions. I think a lot of times, again, for cultural reasons, personal experience, patients maybe don't want to ask the doctor too many questions or don't want to feel like a bother, or
Yeah,
the doctor's so busy. But no, our
yeah,
job is to be busy with you.
yeah,
We're
yeah.
here to help you through the journey and to guide you and with, the most up-to-date information. So the last thing I wanted to touch on was survivorship, and our participant really spoke to that, kind of like, okay, I'm now in the routine phase of things. I'm just coming every 6 months. I'm getting prescriptions, like, so just kind of it feels less intense, right? It is less intense. Before you were coming every 3 weeks, maybe every week because you were on treatment, you were getting scans every 3 months or something, and you felt like all these eyes were on you. And then all of a sudden you're kind of like, sent away and it's okay, we'll see you in 3 months, we'll see you in 6 months, we'll see you in a year. So it feels very much like you're distancing. And I want to kind of share or tell those listening that it's a good thing. It's a good thing that we're spacing out, that we're allowing you to live beyond the cancer, right? I think I heard a TED talk from a radiation oncologist who passed. Unfortunately, she succumbed to her cancer diagnosis. But something that she said was that don't let the cancer define you, and it shouldn't be the only thing that defines who you are and the life you're leading. And so if you're fortunate to get to the survivorship phase, the surveillance visits, enjoy that. Enjoy the months where you don't have to be at the doctor's office, where you can um, do other things or work on other parts of you and who you are and regain your personality, regain things that you might have lost during the journey, rebuild yourself in a way that you're kind of a newer version of who you were. As cancer survivors, you may not ever be who you were before the diagnosis, but at least you can be a new, improved, or a modified version of yourself. Within that survivorship, I think our job as doctors is to help you get back on track and help you navigate the consequences of a cancer diagnosis. I think something that we all have realized is that having a cancer diagnosis and going through the treatments, surgeries, chemo, radiation, whatever it is, it's a trauma. This is a traumatic event. And so part of that survivorship care and those surveillance visits to help you navigate that trauma. Do you need psychosocial support? Do you need any kind of integrative therapy, mind, body, spirit interventions to help you navigate? Is there hair loss issues that you're still dealing with? Skin change issues? Sexual dysfunction issues? We're here talking about women's cancers and how that affects us with our sexual function. Those should be addressed. These are questions that should come up. And if your oncologist can't answer them, they should be able to refer you to the person who can. Nutritional aspects. Sometimes our appetite doesn't come back. Sometimes our taste for certain foods doesn't come back. We can't gain weight, or we gain too much weight. We need to lose weight. So many things. Maybe we developed diabetes because of treatment, maybe cholesterol issues, high blood pressure. All these things need to be navigated during this survivorship surveillance time. And again, if your provider doesn't have the answers or isn't addressing your concerns, then request a consultation or request to see somebody who maybe can specialize in it. Because we're discussing women's cancers and women who go through these, I wanted to just highlight a little bit about the sexual dysfunction. I think as if you're privy to social media or TV or commercials, you probably know that there's a lot more knowledge and spreading awareness of perimenopause, menopause, symptoms, symptom navigation. I think, was it last year Super Bowl had a commercial spot on menopause management and medications. So it is ever present. So much talk about hormone replacement, so much talk about managing symptoms, so that women don't suffer in silence with these menopausal symptoms. And cancer survivors or women who've gone through cancer treatments, if you were premenopausal, like 38 years old with breast cancer, you were put into some kind of temporary menopause that may have reversed, or you may still be in some kind of menopause, weird phase because the hormone function never really came back 100% because the chemotherapy and then maybe any other treatment beyond the chemotherapy has impacted that hormone function. So you're having this dysfunctional cycles or dysfunctional hormone surges. And so you're having all the symptoms, the hot flashes, the mood changes, a decreased libido, the dryness, the hair thinning, all these things that, or just, mood changes, high and low, anxious, depressed, crying one day, laughing another. All these things are real and you're experiencing them not alone. And so it's important to, again, address with your provider what medications, what interventions, what therapies can I use to help me in this phase. I want to become sexually active again. Am I able to? Answer is usually yes. You may need to work at it. You may need things for vaginal dryness. You may need dilators if you had gynecologic cancer that required radiation. All these things need to be discussed. And if your provider is not speaking about it, then maybe ask about who you could see or who you could be referred to. I think again, culturally, you maybe feel a little nervous or embarrassed to ask about it. I mean, as a GYN oncologist, I always bring it up. And then the patients may shy away from it and I don't push it, but I always mention it. I always bring it up and we laugh a little bit or we then delve into deep conversations. But I've noticed there are some patients I've mentioned it at a few surveillance visits, and then maybe by the third or fourth visit, they then open up to me and really then delve into the conversation. And it's great. They've finally found that comfort and are able to discuss it and want to know more, want to improve things for themselves because they realize, oh, this is a part of me that I want back now. And so it's important to remember that is also part of the experience and a way to improve yourself during that survivorship and surveillance time frame. I think, Ebony-Joy, I'm sure you can chime in or have something to say because you are a survivor and you're in this now, and maybe other callers are too, but I'm happy to kind of segue into maybe your part of the talk now, and I'll stop talking. But I think those are really the things I wanted to highlight.
And I'm glad that we were able to I was able to chime in on a lot of things just with my personal experience with what you said. So I just have a few more things, and I think, people are here, and so just to be able to engage people, because I did not have this. And so I think one of the biggest things just in my journey, why you see me sitting here is I came from a background of not talking about personal things. And because I feel I have had such an amazing experience as a Black woman with doctors and practitioners, and I've heard differences because of marginalized communities. I wanted to share that. I have been a part of the different things. One of the biggest things is support. And so I kind of I had to have support. My kids were in kindergarten and first grade when I was diagnosed. And then the pandemic happened. So there was just no way I could do it by myself. And so no matter what part of the journey you're in, if it's support for education, mental health, financial, religious, your family, find support. I talked to Marlene and I'll share some things, but I think that a lot of things have changed. So there's been a large financial impact. I was the only earner in my household. And so there's going to be a long-term impact from that, just because what I could do before, I can't do now. And a lot of the cancer organizations have changed their parameters post the pandemic. A lot of things used to be for active treatment only, but I found an organization that helps with massages. So I got 10 massages covered. And so things have changed post the pandemic. And for especially if you need reconstructive surgery, or just if you need a retreat. I've gone on a lot of retreats. I was kayaking in the middle of the river in Oregon. That I thought I would never do.
Amazing.
But I was like, I braved cancer. I can brave this river.
That's right.
And my dad is not a Nigerian. My grandmother, they had the river people religion. And so I felt like if she has this river as my ancestors, and I battled and conquered a river in a kayak. So I'm finding myself in this, right? Like not letting it own me. And so one of the things I did to a blueprint was I started reaching out. American Cancer Society gave me a list of resources, and in terms of having people driving me to care and things. And a lot of things don't end. Your cancer is not just when you're in active treatment. Cancer is forever. And so don't feel like, okay, I'm 4 years in, but I'm like, I'm still going through this. And so living beyond breast cancer is another place that has just given me a lot of resources, and support connection has just really taught me, talk about it. Even if it's just one-on-one, talk about it. And I think post-care, I'm going through the post-care treatment. I am in hormonal treatment now probably for 10 years. And there's a lot of long-term side effects. So I'm dealing with pain. I'm dealing with the hormonal issues. And so, but just being honest about my side effects with my doctor and practitioners. And now I'm really getting the help for that. So I think that also take care of everything else. Don't just let cancer be the focus, because I'm like, I had to go to the dentist that I hadn't been to in forever. I had to get my eyes checked. Everything. Now I'm in my 40s. So it's like all these other exams. I had my first stomach exam. So make sure that you're taking care of everything, not just the cancer. So, and the last thing I want to say is that my identity is so much more than just this cancer. And I have found my voice beyond voices. And I am honored to sit in this space with you women, because it's not easy. And, you know, I'm a mom, and a lot of times I feel like, why me? Why this? And I feel like, you know what? I got treatment. And so this is not easy to deal with, but I'm here in this space. And if I would have waited, I wouldn't be in this space. And so I'm trying to just live as I can, and share with others and find my voice. And you don't have to be in a public platform to find your voice. Find your voice with your doctor. Find your voice with your family. If your family doesn't want to talk about breast self-exams, you know, we sit and talk about a lot of stuff. You know what? Let's talk about, you know, we need to be doing self-exams from when a child first gets their first period, and know your body. And so there's so much information, like Dr. David West said, and so much out there, but sometimes we have to make the first step. And I think that is a barrier for anyone, not just because of culture and not just because of other demographic reasons, but there are people out there that want to help, and there's information out there that can help. And sometimes we have to start within, right? We might just need to start within our community first, and then we can branch out. But I think that's all I have to say, because I was able to chime in with so much breadth, the breadth of knowledge. I think it's just amazing to be able to have this information.
Absolutely. Absolutely. And I think there are many of us doctors who want to champion with our patients and be advocates and spread awareness. And I think if you know that doctor and you have a friend who needs that doctor, connect them, right? You want to give them the best chances they can. And there are many of us out there who want to help make this journey as easy as possible, for sure.
Thank you so much, Dr. David West and Ebony-Joy. I will put this forth to Dr. David West. One of the questions that had come in was, what steps can be taken to reduce risk of developing breast, ovarian, or gynecological cancer? Do you have any guidance in that area?
Sure. So that's a whole nother talk on its own, but I'll kind of try to condense. So breast cancer risk reduction, or ovary cancer or uterus cancer risk, I think number one is genetic testing, family history. If you can figure those two things out, you can then reduce your risks, right? If you harbor a high-risk mutation or you have a strong family history, you will then have heightened screening. For breast cancer, there is excellent screening for breast cancer, mammograms, sonos, MRIs, and very easy to biopsy. It gets problematic when we hit ovarian and uterine cancer because there is no screening for either of those two cancers. But knowing you have a high risk of either of those would then, meaning family history, would then prompt genetic testing. And if genetic testing shows that you have a BRCA, the BRCA mutation, or maybe you harbor mutations that diagnose you with what's called Lynch syndrome, which is a high-risk genetic cancer syndrome that puts you at risk for uterus and colon cancer. If you find out that you have one of those, then you would then be somebody for risk reducing surgery, or the best screening that we have for those two cancers, which is pelvic ultrasounds, a blood test called CA-125, if indicated, and endometrial biopsy, which is a sampling of the lining of the uterus, if indicated. So just in a nutshell, that's kind of how you can mitigate risk for those cancers. And then the other component is symptoms. Knowing the symptoms of these cancers, knowing breast self-exams, knowing if you feel a lump or feel something that's not normal for you, depending on your cycle, or if you're menopausal, this is something you never experienced before or felt before, seek appointment or guidance from a healthcare provider to figure out what's going on. For gynecologic cancers, ovarian cancer does have symptoms. They're vague, but symptoms that persist for 2 weeks or longer that include bloating, abdominal pain, pelvic pain, changes in urination, meaning more frequent, more urgency, pain with urinating, painful intercourse, feeling very full after eating small meals. If these symptoms persist beyond 2 weeks, seek care from a provider to figure out if something's going on. And then for uterine cancer, any kind of abnormal uterine bleeding, meaning bleeding outside of your normal cycle, heavier bleeding, multiple bleeding episodes in a month, or postmenopausal bleeding. Any drop of blood after menopause is not normal. It doesn't matter if it was pink, a very faint shade of red, 1 drop, 2 drops, or a full pad. No bleeding is normal after menopause. So to help rule out uterus cancer, you need to seek care with a provider. If you've experienced that, then an ultrasound, a pelvic ultrasound will be done, endometrial biopsy or biopsy of the lining of the uterus will be done. And so those are, again, in a nutshell, ways to mitigate risk or diagnose these cancers early.
Thank you. I know we're closing in, but I was just wondering if we had time for one more question. I believe this one would be for you, Ebony-Joy. This is, communicating, the woman submitted, communicating with the medical team at such an emotional time. How does one, do you have tips to make certain that that they're getting their questions asked, that they're having their concerns addressed, that they're following up with clarification? Someone looking for tips on how to communicate with their medical team.
Yep. So I was fortunate where one of my sister's friends introduced me to a person that had just started going to cancer, and she sent me a list of questions. And so literally at my first appointment, it was probably like 20 questions. And so my tip is to write the questions down, because at least for me, when I'm overwhelmed, when I'm stressed, when I'm emotional, most of the appointments I cry. Most of the appointments, I'm just like, I probably blur out mentally and emotionally, and I'm just trying to push through it. And so going in with questions that are typed, or just written down, having them preset. So you're making sure, because a lot of times the doctor is like, do you have anything else to say? And I might have talked about something completely different. And using the technology, MyChart, I have communicated a lot with my doctors now through MyChart. It might be something different, but an online space where if the doctor's not getting it, there are nurses getting it, because that's usually the person who's the contact person. And then the nurse is relaying it to the doctor, and then I'm getting an answer. And a lot of times, because the doctor's busy, right, doing the appointments, but then a lot of times if I call, it's so hard, especially post-pandemic, at least for me. I don't know if it's happening in other areas, but the medical impact, it happened everywhere. The medical community has been impacted. I have seen the same doctors, but their support staff changed and changed and changed. And so it was like the person that I talked to could be a different person when I go to my appointment in 30 days. And so imagine if you're doing 6 months follow-ups or a 1-year follow-up, chance of you seeing the same physician assistant or whoever, it's probably going to be different. And so it's, that information might not get relayed. And so that paper trail helps, that even if it's not the doctor logging in, somebody's that's going to ping to someone. And it's getting better. So I'm starting to they're reaching out to me, whereas I had to reach out to people, but it's still really hard to get people on the phone. So my last tip was just don't give up. Be persistent. If you have questions, they need to be answered. And sometimes it just takes, let me not do this today, let me do it tomorrow. Because you can get a lot when you're not stressed. And so getting to the right person, it can be aggravating sometimes because it might be hours on a phone, or just sometimes I'm like, okay, you asked me back to the same person and they still don't have an answer. So be patient. And I think the medical community has taken a hard hit, and they're recovering and they're trying their best. And then I think just showing yourself grace, and then showing other people grace, and will go a long way, I think. And that's what's helped me in my journey, is just being understanding that I have this question, and I get I'm not the only person, but when can it be answered? Instead of, you need to answer this right now, and I don't like that I've been on hold and this and that. It's like, I get it, but I just really, I'm concerned. I'm not, and they can see when you, it's actually sometimes good to type, because my doctor was like, you were up at 3 a.m. First, let's talk about your sleep. Why are you messaging me at 3 a.m.? And then I got referred to an psychologist
There you go.
because I wasn't sleeping. So sometimes your questions can lead to more treatment. Because you're like, you should not be up at 3 a.m. Messaging us. They can tell when the time is, so things are timestamped too. So being persistent, but showing grace in this changing environment, is I think can go a long way.
I think Marlene, you're muted. Sorry.
Thank you very much. I know that we had arranged for an hour, and I'm sure our panelists have things that they need to get back to, and as well as our participants. So ladies, thank you for joining us. Dr. David West and Ebony-Joy, thank you so much for sharing your expertise, your experience, and your guidance. Everybody have a wonderful afternoon.
Thank you so much. Take care.
Okay. All right. Bye-bye.